My specialty is rheumatology, and so I take care of people who come in typically complaining of joint pain. Although people with rheumatic diseases include rheumatoid arthritis, but also diseases like lupus. They all affect the immune system and the way people feel. They have fatigue and they have pain and frequently joint problems. My job is to treat their the immune problems that they have, which is what I'm an expert in. I love talking to patients, but of course I love talking to them because I love to listen to their stories, understand their life, understand their concerns, so that when we make a decision, we're really addressing the underlying problems. My research area of interest has always been in autoimmune diseases. This is a very hopeful time for my patients. The first thing I can tell them is that we have medications that we know can help them, that can not only make them feel better, but slow the progress of their disease and maybe stop their disease. I also can tell them that if a drug stops working, I have many choices, which is very important. I can also tell them that every year there's usually a new drug that becomes available. So we know we have chronic illnesses in rheumatology that we have to deal with, but we have lots of choices, and I think down the road we're going to have cures for these diseases. I grew up in Minnesota. I went to medical school at Johns Hopkins in Baltimore. My husband's a physician. We met in the cafeteria while we were residents. I love to hike and backpack, so I do that when I have vacations. I play in a community orchestra. I play clarinet, and I'm very active in my church. My favorite thing about my job is actually talking to people. So I'm afraid that I'm just a person who likes to chat, which makes me less efficient. But getting to know patients, getting to understand how their disease impacts their life so that I can actually find ways to work with them so that we can get them back to doing the things they love to do. And that's my goal when I treat a patient.